We have Luis Fuentes Rohr, Maquiba Reese, and Susan Yoon present. The first thing we will do is approve the minutes from the September 16th meeting. Can I get a motion?
So moved that we approve the minutes.
Second.
Okay, all those in favor of approving the minutes, say aye. Oh, are we gonna go by, we'll go by roll.
Yeah, I can take that roll call vote for you if you would like.
Yes, please.
Okay, Luis,
Yes.
Susan,
Yes.
Maquiba.
Yes.
Okay. Then no members abstain and no members refute, or I don't know what the word I'm trying to get to is, deny, I guess. So motion passes, the minutes pass, and then we will move on to fire department business, the report on monthly statistics and training.
All right, thank you. So for monthly statistics, we are at a normal call volume. We're still below our annual averages. The biggest difference is also IU. If you can see on the second chart with IU's numbers, they are at an all-time low. Even with students being back in town, we do have a few thoughts that some of it might have a little bit to do with IU being kind of downgraded in what they're doing. But they've also have some of their dorms shut down, and some of those things have been moved off campus. So that might equate for some of those. But we're actually on track to be not necessarily a record low, but much lower than our overall. We, as a couple of you may know, we have been extremely busy in the past month. So some of our major incidents that we've had, we had a mutual aid for Monroe Fire Protection District. That was the 5 homes on Wickens. We did send 3 crews, 3 full-size crews out. Plus, eventually chiefs and a couple others went out to assist. But what it turned into was a very good operation. In fact, that's one of our little letters of commendation. There was also an old warehouse on West Allen. Originally, the fire was reported as potentially Catalent or the Budweiser plant. We don't want to see any loss, but the old warehouse that is across from those is much better than one of those major manufacturing plants being fully involved. That fire was well on its way to being started before we got there. It was put out, investigated. And I also listed a CPR save with BPD. One of our crew members pointed out that it was a group activity that all of us came together, but it all worked out well. And I just wanted to recognize not only our crew, it was, I believe, Engine 1 on Gold Shift, but it was also Gabby Espinoza. That is correct, right, Scott? I know it's Gabby Esquivel, I think, actually. There we go. But Gabby was the officer that was on scene with that CPR save. For our response times, we have come down just a little bit. We're at 82% on within 4 minutes and 97% within 8 minutes. I do want to point out to the board that we're in a process of reviewing the consultant findings, and we're starting to do some more internal audits on some of the aspects of our response times that we have control over to try to get ourselves in with or
I think you're frozen.
We should screenshot that. No. Oh, I think, is that him trying to get back in?
Yes, we're working on it.
Okay.
I apologize. I think I got cut off from my internet. Lovely, stable internet here in Bloomington. I don't know what the last thing you heard was, but we are digging into our response times and seeing if there's anything left from our side or from our crew performance that could change getting us closer to those goals. For prevention and public engagement, COVID is still fully in effect as far as protocols, and our engagements have suffered drastically this year. This is not a surprise, but we told you that there was no way we would get anywhere near our annual goals on this. So as you can see from that part, we are well behind any of our previous year's performance on those. What we have worked on is internalizing and creating some online type content, which is much harder to track the engagement statistics on, but we are looking to evolve and become a little bit better in the world of social distancing. For training, we have another decline this month. I want to point out that when you average all of them together, we're on track. We went way above, and we're also in kind of the time of the year where people are trying to take off, down several positions. As of today, we're down 4, but we also have several on light duty, which is attributing some of those lost hours. But we are still on track right now to meet our annual goal. So even though it's below the red line, it's not something we're worried about unless the next month's is also below the line. And then that is it for statistics.
I had one question about that fire on Wickens. Oh, wasn't that like 5 houses?
Yes. So 3 houses were considered a total loss, and Bloomington Fire, we ended up having to send both aerials. Basically, what we call bookends. We set up the large aerials on both ends, kept the fire kind of pushed to the parts that were already burnt, and then saved the other 2 houses on the out edges that were starting to get themselves involved in it.
Is that because the houses are built so close together? I mean, it just seems like
There's a lot of factors. How close they are, the construction materials that they're made out of, how long the fire burns before we get there, the amount of water and capacity that you have. And I do want to point out that, we had to put thousands of gallons per minute to be able to contain that fire, which is what those aerials are very good for.
And that's still being investigated?
I haven't really followed up a whole lot with it. It's not in our jurisdiction and really,
okay.
So it is outside. They requested our help to come in.
Oh, I didn't know that was outside your area.
Yep, definitely. It's not within city limits. For full clarity, it wasn't an area intended for annexation, but it's not within city limits and it's not our jurisdiction. We arrived and helped them at their request.
Okay. Letters of appreciation, commendation.
Yep. So we have a few here. One, in the world of COVID, we've had very few visitors. When we do get visitors, we take a lot of precautions to try to still show the fire trucks. This one was written to myself and Chief Washell about Corey Blackwell. He's a firefighter with us, and he did a really great job engaging with them and showing them the fire truck and maintaining COVID protocols. So the other one is from Chief Dustin Dillard, and it is in reference to the Wicken Street fire. Basically just, thanking all the crews that were there that helped them that day with the.
Okay, general business.
For general business, I'm going to turn that over for Chief. And then I don't know if we wanted to talk about the hiring process. I think it's its own bullet as far as approving the list, but if we want to talk about that during the personnel side, I'd be more than happy to.
Is it a separate issue? It's not listed separately on the agenda, is it?
Okay, then
You can handle it in general business then.
Okay.
Okay. Well, then, if it's okay, you want it in general business, then I'll go into our hiring process and the lists, which we are asking for an approval on. So every other year, we solicit applications for firefighters. We have done a lot of work in the past, 2 processes to try to increase diversity within our department, which really boils down to doing a better job of recruitment. So two processes ago, it was in 2016, 2 minority applicants, and that was 1 female and 1 person of color. The last application process, the very beginning, was around a 22% diversity profile. And in this particular process, we had 217 applicants with around a 16% diversity profile. We did have our highest application of African-American males and Hispanic and Latino males that we've ever seen. So we do attest that a lot to the recruiting that we've been trying to do. In the document that I provided, kind of the diversity profile breakdown, you can see kind of the stages. So we get applications, they have to take a written test, and then we do a panel interview. And then from there, that they make it onto our list, which we bring to you for approval. So from the beginning to the end, we saw what we normally see, which is about 50% did not even show up to take the test. So we lost quite a bit of not only all applicants, but of some of our diversity within the applicant pool. We lost it just by not showing up to take the test. Final breakdown of the 83 candidates that we're bringing forward to you for approval. And again, this is how the fire department, we maintain a ready list so that we don't have to go through a hiring process every time we have the vacancies. We can pull from this list that you approve. And then we break our list down into 3 tiers. Tier 1 is the top 90% score. And this is actually the best that we've ever seen in the diversity breakdown. It's around 37%. And there are no females on this, but there are a lot of people of color on that. So that is their written test score with their interview score. Straight scores right across. Number 1 score is number 1 on the list, and so on and so forth. Tier 2 is where our first female candidate ranked. She is in the top end of tier 2. And then the tier 3, you can see the diversity breakdown is that. But what we are very impressed with is that we started out with about 16%. We ended up with close to 16%. So that means that, throughout the entire process, we feel that it was very fair. We had just as many white candidates that were excluded as minority candidates. The testing process this year went very smoothly. In fact, we only had 3 people fail, which has never happened before. And then in the interview panel, I think we only weeded out 14 people that were just not ready to be firefighters yet. With that, the list is there, broken down into the 3 tiers. On the public facing side of this list, it is published by candidate ID number and rank. We do that for a lot of reasons. All of our candidates have their ID, so they know where they're going to rank on this list, but we don't want other employers or other issues coming up from their names being published without their consent. So with that, I respectfully request that we approve this list and that it is good for 2 years. And I'm happy to answer any questions you have on it.
Before we make the motion, I want to applaud the work of bringing in minority candidates. I think that's, I'm really, really, really impressed with that. And it can only get better. So good job. Kudos to that.
Chief, could I ask you a question? So you said from the 217, am I reading that correctly, the total applicants, to 105, that's people who didn't show up to take the test, is that correct?
So the 105 is who showed up to take the test. So we lost the 112 applicants that never even showed up to even take the test.
And that test is, I'm remembering our conversation, that test is part of the final score, only a part of it, is that correct?
That is correct, but you have to complete all portions. You can't just say, I'm not going to take the test and then show up for the interview. It is a step-by-step process with a lot of communication that goes out to the candidates to keep them aware. And we had a lot of people that did not show, which is about normal. The last process, we had 340 applicants and only about 200 showed up to test.
And then, if I may ask you, then you said from the test, and you do the interview, and then you match those together. Is that how you come with a score? Those two prongs, you get the interview and the test together, and then you get the ranking. Is that right?
That is correct. And then by this board's approval, there are state statute preference points. So they're very small preference points for being a military veteran, for being a line of duty death, the child of a line of duty death firefighter or police officer, or if you've been laid off. And we also add preference points if they live in the city or in the county. And these are very small. So that's in a grand scheme of almost, I think it's around 500 total points. It's only 1 or 2 points is added for having a preference. So it's enough to allow a candidate to maybe move up one slot or down 1 slot based on those preferences.
And candidates get scores based on the answers to your questions, is that? And you basically just score them, did you say 1 to 5 or something? I can't remember.
Yes. So we have a panel interview. So it's 5 or 6 members of our department. The panel this year consisted of 2 female firefighters, an African-American firefighter, and then the rest were white males. So our panel was 50% diversity as well. And they have a series of 12 questions that they rank a candidate on a scale of 1 to 5 for each question. And then we go through and take all of their scores as a group, and then that is their master score. By doing the panel, we also look for issues where somebody is way out of the realm. So if they're more than a standard deviation out of the norm score, then we kind of question, is this a favoritism issue? Like, this person and you really want them to get hired, or if you have an issue with that person, you don't want them. But those scores are criticized, and then they're published as a straight raw score that gets added to the written test score.
Chief, not trying to be difficult, but one more question, if I may. So then anytime I see tiers and rankings, I get queasy. I've created enough people in my life to know that those things are fake. And I'm not ascribing anything to you. I'm just telling you, I don't trust them. So I'm wondering, and it's not you, please believe me. So I'm wondering, could you give me a sense when you're asking questions in the interview, what kind of questions are you asking?
Yeah, so every question has been vetted by HR and legal, but a lot of them, I'll give you an example. We look for integrity. So we'll ask about a time that they either saw somebody doing something inappropriate and what did they do about it. We also ask them every process in the past 2, we've asked them about our core values. What does respect mean to you? What does integrity mean to you? What is service and excellence? So a lot of them are really kind of geared towards looking for people with teamwork and integrity. And again, these are all well vetted. And I do want to point out the Office of the Mayor had questions about the ranking and tiering and how do you do that? But we are going to evaluate this process in the future. It's just very hard to categorize when you have hundreds of candidates. How do you pick from the top to the bottom? And without some kind of scoring system, we have, it gets into you're comparing candidates against each other and your memory over 5 days of interviews. We're looking if there's a better way of doing it. But as of right now, this is the cleanest way that we can somehow sort out from 217 applicants down to the 83 that you're receiving as we think they would be good hires.
Okay, I have a lot more questions, but I won't take up your time. That's good enough. Thank you.
Okay, Luis, do you feel comfortable enough for us to approve this list?
Yes, I'd like to move that we approve the list provided to us by Chief Jason Moore.
Second.
Nicole, you want to do the call?
Yep. All right. So I have a motion by Luis and a second from Maquiba. So Luis,
Yes.
Susan,
Yes.
Maquiba.
Yes.
Okay, motion carries to allow that hiring list to be in effect for the next, I think we said 2 years.
And Luis, I share the same concern as a DEI person. Like, oh, okay, these peers, but yeah.
I want to move on. I'll come back to the purchases and some other personal issues, but we're going to move on right to the promotion because Maquiba has another meeting she may have to leave for. So let's try to get that completed so we can make the motion and have that done. So Jason, do you want to talk a little bit about the promotion of Scott Mitchell?
Yes, Scott Mitchell is actually an oddity within our department. we go back many, many years where the contract flipped and they were sergeants and then chauffeurs and back and forth. So he is grandfathered as a chauffeur at the pay level. But in 2017, we changed our contract so that we now have firefighters, chauffeurs, and captains, not sergeants. And his former chauffeur stepped down. And by our agreement with the union, that would put him on the promotion list, and he is up for that. So Scott Mitchell has been driving the entire time since 2017 or before. And this is really more of a formality to give him back his title. It doesn't even affect his pay at this point. And I respectfully request that you promote Scott Mitchell to the rank of chauffeur. I believe it was effective on the 19th of this month.
Does anyone have any questions?
Very quickly, 'cause I know McCreary, you have to go, but maybe it's a police department, but we've been getting some of these, maybe it was you, I can't remember, Chief. These, you call them an oddity, but I seem to recollect people out of position and people with the wrong ranking. And was it fire again last month? I don't remember.
Yeah, so we do have some of these, the former chauffeurs that we're asking to be promoted back to their current rank when their current chauffeur either leaves the department or steps out. Scott Mitchell is an oddity in the fact that he is already being paid at that level. And this was an agreement set forth with the city several, I'd almost say 6 or 7 years ago. So that's the only oddity about it, but we are almost out of what these grandfathered chauffeurs that are left. And what it was is the contract changed and some people did not up that rank, and more of them are giving up that rank or they're retiring that spot vacant for the former people to regain that title and pay.
That was gonna be my question. Why can't we just do them all and be done with them? But you're saying there's not many left. Got it. Okay.
And
I was
please,
just wondering.
yeah, please feel free to ask questions. I'm not in a rush to hurry over. I have a follow-up question. So, in between, what was Mr. Mitchell doing before again? Can you say that one more time for me?
Yeah, so prior to the 2017 contract, he was the full-time driver.
Okay.
And that was a firefighter first class with the command appointment of chauffeur. When we changed the contract in 2017, chauffeur became the merited position that we have to bring to the board, not a command appointment that is approved just by the chief.
Mhm.
His sergeant was automatically made a chauffeur. And so now his sergeant has stepped away and said, I do not want to drive the truck. I never want to drive the truck. And he has now asked us to basically demote him to firefighter first class. Scott Mitchell has been the full-time driver this entire time, and he will regain the title for a job that he has been doing for multiple years.
Okay, so it was no previous situations with Mr. Mitchell to demote him. Now we're promoting him. Okay.
Nope.
And
Well,
what's,
this is clearly kind of a cleanup item because of a contract change. And it was going to be a grandfathering that took years to kind of finish the attrition on it.
and what's the effective date of the change again?
October 19th.
Okay, will somebody make that motion, please?
I'd be happy to. I just want to make sure that I know he's being promoted to not chauffeur, is it? Chauffeur. Okay.
Mhm.
I move that we promote Scott Mitchell to the rank of chauffeur with the date of October 19th, 2020.
Second.
All right. So I have a motion from Luis and a second from Maquiba. Luis,
Yes.
Susan,
Yes.
Maquiba,
Yes.
Okay, the promotion, we will move forward and we will go to fire department, whether you have any, do you have other general business or was that finished?
I
Okay,
believe that's it for general business for us.
okay. Then will you have any large expenditures coming up?
Yeah, I'll take that. We have a couple that are of note. Approximately $25,000. You'll see that come through for a gear extractor. It's for fire gear. We currently have two. This is an 85-pound. Basically, what this is going to give us is the ability to follow enhanced cancer protocols and clean fire gear right after fires. But it'll give us the ability to do that for all 34 shift personnel within just an hour. So that's going to really enhance our operations and being able to get that the PPE back in place if in case we have another fire. And then you're going to see approximately $35,000 for a new administrative vehicle that is now Chief Moore's, and he is currently utilizing that. So those are the two that I have right now of note.
Okay. Okay. Any other personnel issues?
The only thing we have is we have 3 on light duty. We have 3 on light duty, and we have 4 that are out currently sick. I do have one other of note that we just put engine 1, our new fire engine at headquarters in service. And I believe that's going to be around, it took a while to get it in service, but it's going to be around, I think you guys are going to see about $561,000. So that's another one that just a little purchase. So.
Okay.
As far as personal issues, I do have one. We issued chief discipline, I believe it was yesterday. It was a 24-hour suspension for conduct unbecoming with a long list of other issues. That employee, Dan Emmerich, has already requested an appeal. So you will get a request for an executive session in the appeal process going through the administrative hearing. So,
so they're not in a, it's a review, and it doesn't necessarily have to be a hearing. It just needs to be a review by the board to either uphold the decision or just overturn it. And there's no fine tuning of it. It's either accepted in whole or rejected in whole. So that's the process we'll be facing.
okay, thank you, Chris.
Okay, but
And
then
if we,
today,
just quickly,
so-
if I may, Susan, and then if we uphold, then there's a hearing. Is that how it works?
Now, what's going to happen is the board can review the decision made by the chief. And it can be done either in a full hearing or just a review. And if you uphold it, that's the end. It's upheld in its entirety as the chief has recommended for discipline, or has the discipline that's been turned in, or it's just overturned in its entirety and it's over.
Okay, thank you.
Okay, we'll move on to the certification of the payroll from the chiefs.
It is correct.
And it is correct from us as well.
Okay, then we'll move to police department business, the report on monthly statistics and training.
Good evening. Starting with calls for service for September, we were at 3996, which is a decrease from last year at the same time as of most of our months. A lot of that is COVID related. As you look toward the nuisance calls for service, you'll see the breakdown there. Noise at 55%, disturbances at 28%, vandalisms at 10%, panhandling and drunk, of course, are the lesser ones included in that pie chart. As you move on to some of the other categories, crimes against persons went up this month from 96 this time last year to 103. 326 crimes against property. Again, that category is up this month slightly. Crimes against society is up again, but again, slightly. We're talking about there a difference of only 5 events, as our traffic accidents up slightly. That's a difference of 13 events to 107 for last month. As we continue looking at that, our aggravated assaults made up a substantial portion of the rise in crimes against persons. They went from 32 to 39. We unfortunately did have 1 homicide in September that we worked. Intimidations actually fell from 9 to 5, and sex offenses from 7 to 5. Simple assault did rise, but again, only by 5. So it shows a non-significant increase in terms of numbers as a whole. As you continue through, excuse me, as we continue through those things, you will see that most of this remained consistent month to month as it has year to year, although we are down somewhat this year in each category from last year at the same period of time. Again, basically due to the COVID pandemic and some of the restrictions. For a month, last month, our arrests fell from 234 the same time last year to 138 this year. Juvenile referrals from 16 last year to 10 this year. And as we continue through, domestic violence cases fell from 48 down to 44. This is a hate crime reporting period. However, the data is not yet compiled, so we'll have that for you next month. September ended that period, but again, we haven't got everything completely compiled. So those are basically the crime statistics for this month.
Yeah, I wondered if we would see more domestic violence. And I've been kind of surprised.
It goes up and down. And again, it is a cyclical thing where it seems like we'll see a lot of it one day and the next day you don't see much. So it's almost day to day. And then the totals, of course, at the end of the month come out as to what they are. A lot of disturbance runs that may or may not sometimes be domestic disturbances that can't be qualified necessarily as domestic disturbance, but it's still a disturbance run overall that we take and have to deal with. So you may have a little bit of those factors back and forth. The domestic violence arrests are what basically categorizes as a domestic disturbance.
Can I ask a question on that?
If no one's arrested, it doesn't go into your stat.
No, it does. But again, those are the ones you can say absolutely are domestic violence. The others, sometimes it could or it couldn't be, depending upon what people will tell you their relationship is.
Okay.
A quick question on that point on domestic violence. What role does the social worker play in calls, and you call them domestic disturbances? And I wonder, those cases seem ready-made at some point for a social worker to step in and help and do what he, she, they do.
Right. And a lot of them are. Sorry, I interrupted you. I didn't mean to.
No, go ahead.
A lot of them are ready-made. She comes behind after the event is concluded, or at least the initial police response is concluded, able to offer services, able to offer advice, more along the lines of a wraparound, as it were, where she can talk, the victim, as it were, through the services that are available to them, sometimes talking the assailant through services that are available to them as well, provide outlets, provide some counseling services. And again, after the law enforcement action is done, there was a gap, and that gap is what we're addressing. And she does a phenomenal job working with these folks and bringing a lot of things to light for them that are either services available they didn't realize and or things that were going on within the case that they also didn't realize, that she's able to bring a little more clarity to. And a lot of times just having someone to talk to that's not really in the realm of that disturbance, they weren't present there, and this is just an outlet for folks.
I'm asking because I know that social workers have become pieces of this policing puzzle that people are thinking about.
Sure.
And I don't really know. I've met her, we've talked to her, but I don't really know what she does. Like I guess what she does. And I was talking either to Chief Dieckhoff or to the mayor, I can't remember, to somebody who said, you could probably, must have been Chief Dieckhoff, who said he would be willing to bring her back to the board so we can talk to her. I think it was him. Oh,
certainly. She's a very engaging person, incredibly intelligent, incredibly intuitive. And she, quite bluntly, has fit seamlessly with our operations and really added a lot to it. Later under general business, I'll talk to you a little bit about some of the approved personnel for next year, and there'll be 2 more social workers that come online to even further those efforts. I mean, one person can only go so far. She's very busy. She's constantly out doing things or constantly out helping the officers on calls, or again, kind of going behind them to provide wraparound to make sure that person is cared for in the long run, because as you very well know, it's a very daunting system in the justice world. You're going from the police to the prosecutor to, wherever you go within that. And a lot of times people are just simply, I don't want to say lost, but she wants to make sure that no one falls through the cracks where they've got questions that they don't know who to turn to for answers, and she's able to do that.
The reason I ask, my final point is that I know people have come to me and said, and I've seen proposals to remove the social workers from the police department and to have them be independent and that's under another umbrella. And I don't know what that means. Like, I'm not sure, but I'd love to know. I'd like to know your views, of course, not here, but sometime.
Sure.
I'd like to know her views. And I'm thinking through what other people have told me, people who feel strongly that social workers should not be under police departments. Of course, that's not our call
Sure.
at all. But I'm just
and again,
thinking through it.
later in the meeting, there's actually commendation that she played a very large part in. Her and one of the downtown resource officers effectively intervened at probably the last possible moment that we could reach out and save somebody, or very close to it, probably within days. And they were able to be that safety net as a team. My personal feeling, and I'll just say this, and I'll direct you to the chief for further comment from the department, is it is an integral part of what we do now with the police social worker. She is able to provide a huge dimension that, quite frankly, I don't think any of us even thought about when she first came aboard. And I'm not sure that she did either, but working together, it is really building a fantastic system of services that we're able to offer now that, frankly, 5 years ago would not have been possible. And if we remove them from the department, it won't be possible again.
Thank you.
Okay, so moving on to training, if we're good with that. Training hours this month were 1,210. Some of the highlights then were human dynamics and performance during use of force incidents, basic hostage negotiation course, mental health first aid, and of course the monthly CERT and CDU training. Community engagement this month, much like the fire department, we are way down on these just because of COVID precautions that we've all taken. Down to 3 events with 3.4 hours with 6 officers involved in that. Again, not what we want to see, but it's what we can do at this point. We have tried a whole lot of virtual things and individual things. So it's down, not where we want it to be, but that's where we're kind of at this point. No real community events upcoming. They'll be announced. Again, we're kind of picking our way through what we can manage to do and do safely. Back in line with the police social worker, some of her stats this month, she had 30 referrals. She had 189 police contacts or police social worker contacts. Some of the highlights there, she assisted family with mental health services and navigating the guardianship process for their father. Matter of fact, she received flowers and candy, her and an officer that helped the family work through that. She assisted a client with advocating for disability support services through the college classes, and it assisted an uncle who recently lost his nephew with navigating payment for the funeral and other end of life issues that came up that had to be addressed. Neighborhood resource specialists this month took 56 calls for service. They did a lot of extra patrols as well, in addition, that did not count in here. So they provided some visible presence in the neighborhoods and assisted the officers on a number of different other events that are not solely their calls for service, but they were able to provide some traffic direction, and they were able to provide some other things that freed up the uniformed officers to do other things at that point in time. So any questions about any of that?
Very quickly.
Sure.
Just very quickly. Are they based at Switchyard? I remember talking to you guys about Switchyard when they were building the park. It wasn't open yet. Are they there now?
They are.
Based?
They are based out of Switchyard, as is the Downtown Resource Officer Program. None of them spend an appreciable amount of time there, as you can well understand. But yes, they are based out of there.
Thank you.
Okay, letters of appreciation and commendation.
There were, I believe, 4 of those. Forgive me, I have to go to the phone here. The first one came from a couple of people, including Rabbi Bezer, involving the DRO and Amy Ramoser, and involving our police social worker. I guess to kind of protect some of the privacy involved, they became aware of a person who had needed some help. They felt needed some help, but they weren't sure what was going on. So we asked Officer Ramoser and our social worker to go up to this address. They found a lady in exceedingly declining health who had exhausted all of her finances. She had lost her job, had no telephone, had very little food. had very little money left to her, was experiencing significant physical ailment that was not being addressed, to the point where she was horribly dehydrated and required immediate hospitalization. Matter of fact, they called an ambulance on the scene. Both their feelings were that she was probably within several weeks of no longer being with us, depending upon how her condition could or could not have been treated. And was really reaching the end of her rope. But before they left that call, they were able to square any number of things. They were able to get her signed up for Medicaid, Medicare. They were able to get her to the hospital. They were able to get communications to her, meaning they were able to secure a free phone for her. They were able to get her rent squared up, at least where she had some diversion in the rent because she was about to be evicted. So in that 3-4 hours, Louise, kind of back to what you were talking about, why it's so integral for us to have those police social workers with us. Though that officer and that social worker were able to, I don't want to say swoop in, but that's the word that comes to mind, swoop into this lady's life. And for the most part, take care of 90% of her most immediate, most life endangering, most life threatening issues because of the knowledge and how they work together. Somebody knew somebody who could do this, somebody knew somebody who could do that. And they started recruiting people. And within hours, her situation wasn't completely resolved, but her situation was 1,000% better than it had been 3 hours before. And it all started with Leslie Levin, a wonderful young lady, reaching out to us saying, hey, I think we have a problem. Could you guys check? So these very specialized resources went there and found it. And again, while a lot of people would think, why is the police department involved in that? For this exact reason, because the resources are embedded with the police department. The knowledge is embedded with the police department. And, I can't begin to tell you what a great job these two did. They really took care of what had to happen right there. So moving on from that one, the next one down was Captain Pedigo commending several of the officers responding to a call. He'd gotten a citizen who had called in thanking officers for how they'd responded to a call for service, the dispatcher and the officers all. That's included there. We have a generalized to all of our wonderful police officers, thank you, prayers and support from a person. And I be honest with you, I cannot see the last one because of the way it comes up on my phone, but I believe this was one from a visit to the police department, just a random visit where a young family dropped by and one of the officers took time out of their day to show them around, show them the cars. And it was really impressive to the people involved and to the children specifically. And that's it for that.
We'll move on to general business.
General business, we would like to cover with you guys both pillars 5 and 6 of the 21st Century Policing Report. Before we get to that, the chief, who unfortunately could not be here tonight, wanted me to pass along that to make sure that you're aware that the budget passed, so that in the very near future, we will be seeking to employ 2 additional police social workers, 2 additional neighborhood resource officers, or neighborhood resource specialists, I'm sorry, and 1 additional data analyst to help us with, again, data and information servicing process. The budget passed with a cap of 100 officers, and Captain Pedigo, who's with us tonight, will help us on the personnel side of it. And then if you're good with it, we'll come back to the pillars, or would you like to do that now?
We can talk about the personnel part of it.
Okay, good evening. We currently have 9 openings. We have, for the cap of 105, we have 96 sworn officers currently. However, unfortunately, we've got 3 that are in field training. We have 2 that are currently at the academy, and we have 4 that are out on extended light duty. So that 96 drops pretty quickly. We had 1 that did test positive for COVID a few weeks ago. However, he is recovered and he's back to full duty. So that's good. We do have, we were notified this week that we do have 3 officers that are in background investigations for other agencies. And in looking at the fires list, it looks like 2 of our officers made their list, 1 in tier 1 and 1 in tier 2. I do intend to have a hiring process in the near future. However, to be honest with you, right now, I'm unable to find a location to do the physical testing, which requires the use basically of a track, or at least it would need to be somewhere where I could have measured distances for the physical testing. None of the schools in our area are allowing anyone outside in due to COVID restrictions. So I'm struggling right now to locate a place where I can actually hold a hiring process, and then also for the inside testing portions to make sure that everyone is spaced appropriately. We fall much along the same line as fire. Right now, I believe when I counted yesterday, I had just shy of 300 applicants since our previous hiring process. However, it's not uncommon to only have anywhere from 50 to 60 maybe show up for the actual testing date. So we are working on that. I did have a question for the board, if I may. I had sent an email to board members requesting kind of some assistance if you happen to know of anyone that might be interested in joining the police department. I know obviously that a lot of you have several ties to boards and the university and things like that. And I wasn't sure if anyone had any success in finding any potential applicants or not.
Nobody came to my mind.
Can I ask you on that point? First, thank you for sending that. It's
Sure.
greatly appreciated, greatly appreciated. The second point, I sent it to some people and I haven't heard yet. What is the timeline for them to reach out? And I'm assuming reach out to you. That was my second question, right? If I have a name, do I have them connect with you or the?
You are certainly more than welcome to. I think in the email that I sent you, there was a link to our online application form, which provides me with their contact information and will ensure that I send them an email when I actually announce the testing date. In all honesty, right now, my testing date was set for November 21st, which is a Saturday. It was going to be Saturday morning, but I have to secure a location before I can actually finalize that. So I've not shared that with anyone else as far as the actual date, because I haven't finalized it as of yet, but I'm looking for about that third week of November.
So then in reference to that date, what is the timeline and how, if I were to hear from them, I'm assuming you need some legway, time from the moment they apply to the time that the test happens. So when is the range of time when they could get through the application process online to then be able to be tested or to be a part of the process?
It's a very, very short, it's basically just a very general information. The online application is only approximately 8 questions. It's basically just contact information. It's not anything like our full application that they would be required to provide later. To be honest with you, I'll take them right up until the day before. I just need, matter of fact, it's not uncommon maybe to have 1 or 2 people that show up that for some reason or another, their names didn't even make it on the list. And as long as they have a valid government identification card and they meet the criteria for testing, I'll certainly let them test. I don't want to turn anyone away. We want to make sure that we have the largest pool to pull from that we can. So yeah, really, it would be nice if it were maybe by like Wednesday or Thursday of that week in November, just to kind of give us maybe a better idea of who might come. But to be honest with you, it could be right up till Friday evening, and I'd be more than happy to test them Saturday morning.
Great, thank you.
Anything else on personnel, Ryan?
No, I don't believe so. We don't. We have no. We have no discipline to report, and I don't believe I have anything further.
Okay. Then we can go back to the pillars.
Okay. Tonight, we want to conclude our review with you, as the mayor has asked us to do, of Pillar 5, which is training and education, and Pillar 6, which is officer wellness and safety. Up front for tonight, it's a fairly short process because most of the ones involved in both of these pillars were directed at people other than the police department. They were directed at Congress. They were directed at Department of Justice, some outside training entities and academies, which doesn't necessarily relate completely to us, but there are some items that do, or at least that we've made progress in that we wanted to share when we initially authored the final report. As you skip down to recommendation 5.2, the law enforcement agency should engage community members in the training process. I think BPD alone has engaged a significant amount of our citizens in the process, both through Citizens Academy, but also using the subject matter experts that are available to us in a wide variety of different things, from either Indiana University, from IU Health, Bloomington Hospital, from Centerstone, from some of the other service providers that our agency works so closely with every day. We have them come in and teach and train the officers. They offer guidance on policy, guidance on programs. And I think, at least in my years of experience in the last 5 or 6 years, that is very unique for a local police department to have so much crossover with the different entities. And frankly, we are very gifted in the fact that we do have so many, high-end entities available to us at just a phone call that are able to help out. As we skip down to recommendation 5.3, that law enforcement agencies should provide leadership training to all personnel through their career, beginning with the day they walk into the police department and all the way up till your last day. You constantly have ongoing training as it relates to leadership and to what the department holds as a standard. We send officers, in their very first stages to different programs to assure that they have the best well-rounded education moving forward. As you move through your career, you go to different specialty training as it relates to leadership, whether that be an individual specialty that you're involved in or simply a specialty of being a police officer. We expect you to go to certain things. As you become a senior police officer, we get into the Senior Police Officer in Charge program, which is basically taking those senior officers and putting them in a more leadership role day to day and minute to minute, asking them to help run the shifts, asking them to help take on responsibilities that an officer first class wouldn't have. Field training officers, of course, have leadership every day that they have to exhibit. As new sergeants, there is a series of special schools that you have to go to that we send folks to and make sure that they get the most well-rounded education, including all the way up to what's called Police Executive Leadership Academy, or PELA, that all of our supervisors must graduate, which is a 160-hour course. It's a 30-day course that we send them to. That is a competitive course at executive level that everyone from sergeant on up in the department must go through. That teaches a wide variety of leadership and leadership skill sets, and teaches you that there's different types of leadership, and what leadership works best for me may not work best for you. And that way we can kind of tailor our ongoing operations, as it were, to either the different generations we're supervising and or the different cohort that we're supervising in regard to what kind of officer we're dealing with. Most of the rest of that policy continues to be the responsibility of other entities rather than the police department. I did want to make one note that recommendation 5.6 is that posts, which are academies, should make crisis intervention training a part of both basic and in-service officer training. BPD is one of the few in the country that mandates that all of our officers are CIT trained, crisis intervention team trained. In addition to mental health first aid, we were one of the first that I'm aware of, and I think anybody's aware of in the country, to make sure that all of our people went through it, not just a select team. As you see, some agencies have a team of crisis intervention officers that will take mental health runs. We mandate that the entire agency, every officer, goes through crisis intervention team, which is the top level tier for, at this point, patrol officer training for mental health, and they all have to go through that. There's also an item about law enforcement agencies, and this is 5.9.2 action item. Law enforcement agencies should implement training for officers that cover policies for interactions with the LGBTQ plus population, including addressing issues such as determining gender identity, arrest placement, the Muslim, Arab, and South Asian communities, and immigrant or non-English speaking groups, as well as reinforcing policies on the prevention of sexual misconduct and harassment. As you're all very well aware, Bloomington Police Department has a long history of working very well with diverse cultures. We have training to work in this diverse environment. Begins with the probation officer training course, which begins within the first few weeks of an officer's employment. BPD several years ago established the LGBTQ plus liaison positions. Continues to work with that community to make sure there's mutual trust and respect. And all of our policies and procedures are vetted by CALEA, the Commission for Law Enforcement Accreditation process, and they continue to be vetted, as that's an ongoing process that we have to continue to meet each year. So that's the end of Pillar 5 in a nutshell. A quick look at Pillar 6, which again is officer wellness and safety. Again, most of these are directed to outside agencies other than a police department. However, recommendation 6.2 is that law enforcement agencies should promote safety and wellness at every level of the organization. This is one that we take very seriously in the fact that even in your first day and every day thereafter, you are literally graded daily on your officer safety practices. And that is one thing that is harped upon during the field training course. You get a numeric score every day from seasoned officers as to what your officer safety was. The wellness issue is a very broad topic. We've put a lot of emphasis on in the last few years, both physically and mental health awareness and wellness. We've done a lot toward that and are continuing to effort that process, even to the point where there is a new weight room going to be built down at the range with a substantial amount of input from subject matter experts outside the department and even more from subject matter experts inside the department, our training staff, as to what should be down there and why. Skipping down to recommendation 6.4 is that every law enforcement officer should be provided with individual tactical first aid kits and training, as well as anti-ballistic vests. As you're well aware, state law currently requires that we provide ballistic resistant vests to all officers, bulletproof vests. We mandate their wear for uniformed officers. For anyone else, it must be immediately accessible to you. So that doesn't mean in your office or in a locker. That means right close to you. The uniformed officers must have it on anytime they're on duty. The tactical first aid kits, there are a tremendous amount of them out in the field with the officers. Each officer is issued tourniquets. Each officer has been taken through a complete trauma care course. And they are very, very adept at working on trauma, whether that be stab wounds, gunshots, falls. Some of them get very, very good at it and are able to provide a lot of life-saving care. Frankly, as you've noticed over the last 5 or 6 years since we started that, there's multiple saves that come as life-saving awards during our award ceremonies because of this type of training. And finally, the department as a whole is recommendation 6.6. Law enforcement agencies should adopt policies that require officers to wear seatbelts and bulletproof vests and provide training to raise awareness. We have, since I started, which is now almost 31 years ago, required seatbelt usage, always. And the officers do. It's just a matter of course. The policy on bulletproof vests changed about 10 to 15 years ago, and that's been in place since. And quite frankly, both of those things have become such an ingrained matter of culture for us that no one ever thinks to even question it. There's no need, because both of them are at the top of why officers get killed or injured every year is traffic accidents and or an event where the ballistic vests would help and or save the officer. So that concludes the entire 21st century report once again for you guys. If you have questions, be more than happy to take them now, or we can answer them via email or offline when you want.
Luis?
I have questions, but not about this, so I can wait.
Wait a minute. Are you just gonna make up some random questions?
Should I go ahead?
Go ahead.
No, I don't have anything. We did this not that long ago, and if anything comes up, I'll put them in writing. I have a question because we talked about something you said, reminded me of it as well. You talked about seatbelts. Well, last meeting, we talked about face masks or face coverings.
Correct.
And the chief told us that you have a policy about wearing them. Well, in the last week or so, maybe, I've received more than one question about police in town not wearing face masks. And the question wasn't accusatory. It was rather, what is the policy? Because one incident, for example, at People's Park, I believe it was, 2nd Street, and there was a lot of police cars. And as I thought the chief had told us that the policy was, when things are happening quickly, that police couldn't reach for a face mask and then go and tend to what needed to be tended to. But when they had more time, that they would wear face masks as a policy of the department. Well, a few people told me that People's Park incident, as police kept arriving, there were numerous police cars that police were not wearing face masks, and they were in pretty close contact with people at the park. So again, I'm just asking what the police policy, what your policy is in reference to wearing face masks in the city.
Sure. It's a directive. It's not yet in policy format. I mean, as far as a general order. That being said, it follows the CDC guidelines and the state of Indiana guidelines is when the officers cannot socially distance on a call, they're to put on a mask. They, again, as the chief explained last time, there are certain rapidly evolving situations that do not allow for them to quickly grab it, but they're to avail themselves of it as soon as they possibly can. I'm sorry, I don't know what call you're referencing at People's Park. If it was one call a month, I might know what we're talking about, but unfortunately we're there a little often for my taste, but I can't speak directly to that incident, so I can't give you any insight there. The only thing I can tell you is the directive that we put out is that we expect when the officers cannot socially distance, or particularly when they're inside someplace, that they wear the department provided mask or another mask that they have access to. All of them are departmentally provided, but we bought some with the department logo. So again, it kind of makes it very apparent who you're talking to rather than, we've had some folks that have called and complained that I would, why is this officer mask? I don't know who they are. And we've had both complaints back and forth. So we went the extra step and had the department logo put on some. I'd be honest, some of the officers prefer the more kind of the blue surgical disposable mask so that they can change out the mask several times in a shift rather than wearing the same one. So we give them the option either way.
Could I follow up quickly? You said it's a directive, not a policy. Specifically, what does that mean?
Well, a general order is a long, very involved process that to generate that. A directive is the chief has a standing order. This is the order of the chief. You will follow it. So
that was a question. So it's an order they must follow. It's not an opinion. It's not a suggestion. Is
right.
Okay.
Right.
Okay. That was okay.
Basically, the difference is general order is meant to last years. The directive is meant to last a temporary amount of time. And we all hope and pray that, the COVID issue is able to be rectified. So we have not yet put it into policy, but I think if it stretches out longer, we may have to entertain, something like that on a general order level. But as of yet, there's no specific reason to do that. So we've left it at its chief standing order. And quite frankly, while the general orders are a little more formalized, all they are is the chief standing orders in written format so everyone can reference them. In this case, the chief has been very upfront. This is what he expects.
Great. Thank you.
Is that it for general business, Scott?
It is.
Okay, then we will move on to whether there are any large expenditures coming up.
There will be. The fleet is being put together for the year. There were 10 of hybrid SUVs that were purchased. They're the first law enforcement specific hybrid that was ever built that's pursuit rated, which means rated for light and siren activity. So we've taken the step to purchase 10 of those this year to investigate whether they'll work for us in the long run. Unfortunately, they are costly. I think you'll probably see them one at a time, but that one at a time cost is going to add up to somewhere in the neighborhood of $535,000 before we're done. It takes, unfortunately, a lot of equipment that's specific to that vehicle that doesn't carry over from some of the other vehicles.
So you said SUVs, right?
They are. It's called a police. Let me get it right. It is the Ford Police Hybrid SUV Interceptor or Utility Interceptor.
And are those replacing other current SUVs or more patrol cars?
No, these are patrol vehicles. And let me kind of reference that up front. The reason we went with SUVs this year is we have very little choice any longer. Ford no longer makes a patrol car. So in this case, we don't have a choice to go to a Ford vehicle. The only pursuit rated vehicle, and there's only 3 of them out there right now, that we can basically use for emergency use is the Dodge Charger, which we have some of those in the fleet, not yet available as a hybrid. The police SUV, which is what we bought, the Ford one. And there's a Dodge SUV as well. Again, not available as a hybrid. And there's a Chevy SUV, the Tahoe, it's a specific police service package, also not yet available in general issue as a hybrid. So we really wanted to look at that hybrid issue this year to see if that technology is mature to the point where it's viable. Ford is promising a lot of savings. up front, you don't see it, but hopefully in the long run, both environmentally and in cost, it will amortize out. I have questions personally, but we'll see.
Okay, then next on the agenda is old business, and we don't have anything that carried over from last
I
time.
believe so, no.
So then we will do, was there a CERT or an ARV deployment?
There was not.
Okay. And then this is the time when we would take our public comment. So we have one person, L Lane. And if you'd like to make a public comment, you'll be limited to 3 minutes, but this is your time.
And the way that we've been handling that is to have them message if they wish. So
Okay.
I would say give it a moment. And I will confirm that I have not had any emails for comments sent in as well. So.
Okay, I'm going to assume that there's no public comment at this time. And if someone would like to make a motion to adjourn, we will. You have to unmute yourself, Luis.
Yes, I do. I move that we adjourn, please.
Okay. All right, thank you, everyone.